If you're having a knee replacement, there are some really important things you need to understand about the recovery process to get you back on your feet as fast as possible. Hi guys, it's Dr. Adam here, orthopaedic surgeon. When you speak to people after a knee replacement, there are often some particular things where they say, I wish I'd known about that beforehand. In this video, I'll run through the top 3 things I find people overlook when it comes to knee replacement recovery, and I'll give you some practical tips to help make your recovery journey as smooth as possible. If you're having a knee replacement, do check out some of my other videos and consider subscribing. As always, this video is for information purposes only, and you should speak to your doctor before making any decisions about your care. In my experience, I often find that people say a knee replacement is more painful than they expected, especially during the first week or 2 after surgery. There are lots of strategies to help you deal with this. During a knee replacement, surgeons usually inject local anaesthetic into the wound, and together with the spinal anaesthetic and sometimes additional nerve blocks that the anaesthetist may have done, all of this can give pain relief after the surgery has finished. Now, this eventually wears off, and usually it's on the first evening or night after surgery, so it's really important to get the painkillers on board. Your doctor or nurse will tell you when it's safe and how much of these to take, but don't be shy about taking them if they offer you, as it's better to have them on board before the pain starts to kick in. The next thing to understand is that when you have surgery, there's a huge inflammatory response that peaks in the first few days with pain and swelling, and ice really is your friend to help cool down the knee. You can wrap some frozen peas in a towel, apply an ice pack, or use a commercially available system, but the main thing is regular cooling of the knee, so 20 minutes on, 20 minutes off, especially in those first few days. Make sure not to apply ice directly to the skin, as it can cause a cold burn, or if it becomes uncomfortable or otherwise advised by your doctor due to medical conditions, then stop. But for most people, it's a safe and effective way to get pain relief. Ice and regular painkillers can make a big difference to pain relief, and a top tip is to try and stagger these. So supposing you're taking 2 different painkillers, you can have one at 9 a.m, and then if possible one at 11 a.m, and then after this ice the knee, so that after lunch you're ready again to have the first painkiller, and that way you have something that's always around to help calm down the pain. The second thing I find people don't really expect is the swelling. Now, swelling after a knee replacement can last for at least a year, and even then the knee is often a bit puffy compared to the other side. So if you go home, when should you be worried? Well, some of the red flags to look out for that should prompt you to seek medical attention are a sudden or sustained increase in swelling, including in the thigh or calf, and this may indicate a problem in the knee or a blood clot or DVT. If there's a significant increase in pain, wound problems or redness, if you feel unwell or are struggling to weight bear or find that the range of motion is reduced, all of those things should prompt you to contact your doctor. So swelling can create a lot of stress and anxiety. If in doubt, see your surgeon, as unless you've seen hundreds or thousands of post-operative knees, it can be really difficult to say what's worrying and what's not worrying. Finally, failing to prepare is preparing to fail, and I find that most people underestimate this. There are some really simple things you can do to prepare for a knee replacement that can make a big difference to your recovery. Do your shopping before, stock up the fridge so your meals are ready to go. Consider home adaptations in the bathroom, the toilet, and on the stairs. Check your mattress isn't too low, as bending down after a knee replacement can be painful. Have non-slip mats around the shower, and consider getting waterproof bags for the first couple of weeks to keep the wounds dry. If that was helpful, please click subscribe below, and I've made another video on specific rehab goals to aim for.